Welcome to the HealthBeats podcast, brought to you by the inaugural Abu Dhabi Global Healthcare Week. The HealthBeats podcast series is your window into healthcare industry news making headlines and the role of Abu Dhabi and the UAE in unlocking global healthcare momentum. We give you insights into the future of the global healthcare sector and Abu Dhabi's contribution to it. I'm your host, Lara Satrakin, and we have a very special, jam-packed episode today. We're going to hear from four different voices, four members of the steering committee of the Partnership for Health System Sustainability and Resilience. Emmanuel Cobabianco, the Chief Strategy and Impact Officer for the World Health Organization Foundation. Iska Rage, Executive Vice President for Vaccines and Immune Therapies at AstraZeneca. Jan-Willem Scheekhond, Global Head of Government and Public Affairs at Philips. And Anna van Poek, Global Head of Healthcare for KPMG International. Today's episode is entitled, Working Together to Strengthen Health Systems. Jan-Willem Scheekhond, thank you for joining us.
Thank you.
Will you start by helping us understand, what does health system strengthening actually mean? What does it look like? And how do we do it?
Great. Well, thanks for the question. So health system strengthening is really about improving the performance of the healthcare system so that it better serves the population's health needs. And knowing that the needs of this populations are going to change over time. And therefore, you need to look at this in two ways. One is the sustainability of health system strengthening. Can you sustain the changes over time as societies change, demography changes, the economics change, technology disruptions come, social changes, environmental change. So sustainably keep that level and keep going and growing and improving the care for your populations over time. The other thing is it needs to be resilient. That means it needs to be ready for shocks and stress, long-term stresses. Now, we've seen a lot of that, of course, with COVID, the pandemic, but you also see stresses like climate change, floodings, like we've seen in the region recently, but also warfare. War displaces people and causes new stresses on health systems.
Malnutrition spikes, a lot of things happen.
Absolutely. So health system strengthening is about, can I do it at the long term and continuously improve my care delivery? That's sustainability. And can I do it while absorbing shocks or preparing for shocks? That's the resilience of the healthcare system.
It sounds like a lot of scenario planning.
Yes, true.
A lot of supply chain planning.
Yes, all of those things are important. And you will find out that whatever scenario you came up with, the reality is always going to be different. So that is that's why you need to continuously monitor the performance of your healthcare system.
Emmanuel, thank you for joining us. This is a very big undertaking, a collaboration to strengthen health systems around the world. Why do we need it now? And how is it going to overcome the challenges that we know we're facing?
Well, health systems are critical for the well-being of people like you and me, but also for the well-being of people in low-income countries that are threatened by diseases, hurricanes, potential new epidemics, and even future pandemics. Investing in health systems is investing in protecting our lives, the people that we love, and also the rest of the world. And it's really based on the understanding that the health of everyone is interconnected. Investing in a system is an essential need, and requires a collaboration that the PHSSR, the partnership that the WHO Foundation is part of, has been trying to promote across the world.
And how is this format, this multi-stakeholder PHSSR effort mobilization, how is it going to be able to tackle challenges in a different way than we've seen before?
Well, we are working very, very closely with governments at the center, and really mobilizing their researchers with our research. We have London School of Economics that's leading a lot of the research in 30 plus countries to get the evidence out, the data on which we can take actions to change the policies in countries.
Smarter policies, better planning for the next shocks, challenges, current shocks, challenges, everything.
Yes. And I would say the next challenges, the big ones that may come, but the health systems are built on the day-to-day, on the challenges that exist. There are many already, without having to wait for the next massive emergency, to the next pandemic. And the beauty of this group is that it brings together governments, research institutions, but also the private sector. And people like the WHO Foundation are really trying to bring together different actors to work all together.
Iskra, thank you for joining us. I want to talk a little more about non-communicable diseases, NCDs, diabetes, other long-term chronic issues that people face. They place a tremendous burden on the healthcare system, on people's lives, what it takes to keep care going. So tell us how resilience, how system strengthening can play a role in how these long-term NCDs are managed.
So basically, healthcare sustainability of the healthcare is really about how the healthcare system can continue to deliver for the patients and how it can improve the patient outcomes. And here, the management of the non-communicable disease is critically important because those diseases are basically the biggest burden for the healthcare system. If you think globally, if you think today, there's 1.5 billion people in the world with the non-communicable diseases. Those diseases are killing 41 million people every year. And we all know that the population is aging. With the aging population, obviously the problem will become only bigger in the future. There is another aspect of that, and that is the shortage of the workforce. World Health Organization is projecting 10 million health workers shortage by 2030. So you have the budget austerities in general, you have shortage of the healthcare workforce, and you have increasing burden of the non-communicable diseases, which means, in a simple words, the healthcare system as is not sustainable. Now, what is the key thing that we can do is really, as I mentioned, act early as possible. So you basically keep patients out of the hospital, decrease the number of the exacerbations and the worsening and any type of the hospitalization.
Very interesting. I thought you were going to say something else. So this is prevention as a way to maintain the stability of health systems. I thought you were going to talk about innovating. So I know that's something you also think about quite a lot, is innovating the way these things are cared for. You know that the population is aging. You know that they'll have to be taken care of. Countries get richer. They see higher incidence of diabetes. So, but you're talking on the prevention side as a measure for these health systems. Is that getting a lot of uptake? Is that way in really becoming the norm?
Yeah, so prevention is very important, but it's not only prevention because people kind of tend to define it differently. I mean, prevention includes any early intervention. So it's not only prevention of the diseases, neither, but I will not disagree.
As good as that would be, yes.
That's also important, but it's really how we detect disease and diagnose it in the early stage. Because if you think about the lung cancer, for example, if you identify the patients and treat them in the early stage of lung cancer, the cost of the treatment are 3 times lower and the outcomes are obviously significantly higher. If you take the chronic obstructive pulmonary disease, the treatment we know that prevalence is increasing significantly. 60 times is the difference between the cost of the treatment in the mild exacerbation versus severe exacerbation. Not to mention the impact, obviously, again, on the patient outcomes, and equally on the sustainability or the impact of the climate and the carbon emission. Because don't forget, there is this other angle of the healthcare, and healthcare and climate are very, very linked. I mean, healthcare system represents 4% of the overall CO2 emission.
Wow.
And the management within the hospitals, like dialysis or the just mentioned intensive care units or management of exacerbations of the patients, are those that are really representing the majority of the carbon to emission. So basically, by early detection and early action on the chronic diseases, you will impact the patient outcomes, you will impact the healthcare sustainability, you will impact the climate and the carbon emission, and at the end of the day, you will impact the costs that will then again play a role in the better healthcare sustainability of the future.
Can you share how you're thinking about the intersection of climate and health?
That's a big area of focus for the PHSSR, for the WHO Foundation, because it's where health systems are going to be challenged the most in the next years and the next decades. Health is severely impacted by climate change.
Everywhere.
everywhere with a but, and I'm coming to that in a second. Frequency and intensity of weather events is increasing. So you have more cyclones, more floods, more droughts, prolonged, and the effects are felt everywhere. It's no longer an issue in the niche. It's on the newspapers everywhere, every single day. But the impact is felt particularly amongst the population that are most vulnerable. So while the carbon emission over the past decades has come from large countries that have reaped all the benefits of industrialization and globalization, where you're feeling the strongest negative impact of health is on a small island in the Pacific, is in a village in the Eastern Africa, in Somalia, where cycles of droughts and floods have increased mortality by many, many folds. And that's where I think we need to intervene with policies that are global, some of them, but others that are really national, that can reduce, on one side, the carbon emissions, which is a big problem in the health sector. On the other side, protecting the facilities, protecting the health systems to respond to the emergency that will be related to climate events.
The name of the initiative is long, but it's also very beautiful and very robust. Partnership for Health Systems, Sustainability, and Resilience. COVID-19 was a shock. It was not unknowable. It was not unforeseeable. I mean, SARS and other such shocks had occurred. You're talking about more shocks coming online, or at least broadening the scope of how we might think of a health systems shock. The global financial crisis, right? And so how do you account for that? How do you look at the fact that we're going to see more of these shocks? They're going to be coming from places we can probably predict, but you have to sit down, focus, and plan and design for those shocks. I mean, how do you take it all in and manage?
It's a challenge because I think the nature of human being is to not think about the worst outcomes. And in a way, I feel we are now similar to where we were in early 2020 when COVID started coming up in Asia. And there was a group of public health professionals that knew where this was going, but nobody was listening. I feel for climate, we are exactly the same position. Scientists are talking very clear about what is going to happen, but the listening is not necessarily there. So the first point is gather data, gather evidence, and then ensuring that both the public is aware and can sustain interventions, and then politicians take actions. And I think to get politicians to take actions against shocks that are very far away, it takes real leadership. The political cycle is short. And to go into interventions that look at strengthening your hospitals against possible typhoons, investing on human resources, mobilizing more financial resources for something that may be coming is not an immediate choice. And what we are trying to do that is the right thing to do, and trying through evidence, through collaboration, to show why this is the right thing to do. And there are countries, and we are now in Abu Dhabi, where we are seeing that type of leadership really driving an agenda that is greening the health sector and setting the country up for a better preparation for climate changes and potential events. It's critical that we take this extremely seriously, because the future, unfortunately, will see more of these unfortunate events happening.
Anna, thank you for joining us. You are part of this incredibly important coalition, mobilization, and you look quite a lot at financing. Tell us a bit about the role of financing for the resilience and sustainability of health systems. What does it look like, and how is it different from anything that we've seen to date?
Yeah, I think financing is really crucial to the sustainability and the resilience of healthcare systems. What you see is that a lot of countries are struggling or are having the ambition to create and to introduce universal health coverage. Very important to get stability in your society, very important to give people access to healthcare and to make healthcare equitable. However, the big caveat in introducing universal health coverage is, of course, how are we going to fund it? How are we going to finance it?
How do you incentivize the right things?
And how do you incentivize the right things? Yes. So what we see is that when you want to create a sustainable and a resilient healthcare system, you really have to think very well, what are the funding mechanisms that we're deploying, and how are we going to deploy our funding mechanisms in such a way that we are actually strengthening our healthcare systems?
This idea of value-based care, that we set the right targets and that we're paying providers for the kinds of things we want to see: prevention, quality care, etc. We've been talking about it for at least a decade or more. At least I've covered for a decade, I'm sure for much longer than that. But it's still a concept. We haven't moved to it in reality. So how do you bend systems, behaviors, incentives? Well, how do you actually get to value-based care, to prevention funding, etc.?
Yeah.
What it worked? What have you seen? Any systems that have done it?
Yes, there are definitely systems that are doing it. Actually, you see HMOs, like what you're seeing here in Abu Dhabi, where you put the insurance and the provider space in one. We see that generally, globally, as being a very strong foundation for successfully implementing value-based healthcare.
But in some cases, they exist, but they don't. So
Yes.
what makes the difference?
What makes a difference? What makes a difference is that you start looking at healthcare system as an integrated ecosystem and start paying for an integrated ecosystem. So stop thinking about funding separate institution and trying to, to reward them for what they're doing. Try to reward and fund the integrated care journey for a patient, and try to reward it and fund it in such a way that the patient receives exactly the right care in the right place. So moving
Seems
that,
so simple. Yes.
it seems very simple, but there's a lot of individual profits and there's a lot of individual interest that will make it very hard. Creating value-based payment, what I see is creating real value-based payments needs a very strong determination from governments. It needs a very strong determination from the funders, because it might also mean that you take some funding away from your vested healthcare institutions and start rewarding primary care, community care, prevention more. So it's actually moving that financial needle and moving the sources of funding to another institution or to another organization. And that's a hard thing to do. So creating value-based funding and value-based outcomes means that you rethink the design of your system, that you rethink what you want to really get out of it, and that you are willing to rethink the way in which you fund your systems in the same way and get all your stakeholders into that journey together with you.
You want to think that every government, because in a way, every government ends up paying for healthcare, in some cases more directly and more comprehensively. But you want to think that every government would say to the health systems in their country, I'm paying you to keep people healthy or to prevent disease. But why is that so difficult to see?
I think till now we've had a lack of data. So the good news is we're getting more and more data, and we're getting more and more insights in where are the population needs, where do we need to start spending, where do we need to start spending on prevention. We are getting more and more data in terms of outcomes, what works in healthcare, where are we going to bring the funds. And at the same time, I was just saying, I think creating value-based payments and really implementing it is not only, it's a funding change, it's a design change, but it's also a cultural change, because it might mean that we take funding away from medical professionals, bring them to things like community nurses, social workers. And that is a very difficult cultural transformation that we would need to make.
Not to mention behavior change for health prevention.
Yes.
Not sort of feeding junk food for the first 30 years and then getting the
So
consequence later.
it needs very much a health in one approach. It means very much that we're not only, when we think healthcare, we often tend to think hospitals, big infrastructure. If you want to really fund for value, if you want to really create value-based healthcare systems, you need to start rethinking what you define as healthcare.
Nutrition.
And
access.
where you are working on. Yes.
It's incredible. all of our countries are going to get older. Some of them sooner than later.
Yeah.
Europe is aging, others are aging, Asia's aging. This region is quite young now, but that just means there will be later down the line of quite a large cohort aging together. So how are health systems going to have to set themselves up to cope with that?
There's a number of things that we need to think about. When it comes to funding, we need to really start thinking upfront, what are the needs of our society going to be in a couple of years? Not now, but what are they going to be in 5-10 years' time? What is our population going to be? What is the epidemiology going to be? How are we then going to treat patients? What do they really need? And how are we then now going to set the funding aside in order to pay for that? Does it mean more costs? It means different costs. It means starting to think about what are you still treating, starting to think about how are we going to, once again, fund prevention? How are we going to fund care rather than cure? But it also means that we need to rethink where are the resources coming from that we're going to use for that funding. We will need more resource pooling. We will need more risk sharing in societies. So governments and policymakers will need to think of a whole scala of interventions that they need to start taking now in order to cover and to cater for the future.
Systems thinking for system strengthening. I'm fascinated by how some systems will have the capacity now to invest in technologies and solutions that can scale globally. Are you seeing solutions already that will bring down costs and enhance resilience in multiple places at once?
Oh yeah, absolutely. Yeah, especially we see one of the most important elements of the healthcare system is, of course, the workforce. So employees, the workforce is all we got, right? Without that, there's no health system. And we've seen that the recent shocks have not done a favor to attractiveness of working in the healthcare sector. In fact, a lot of people have left the healthcare sector. And what we've seen from the research is that every country is suffering from workforce shortages. How do we get them back? How do we retain them? How do we train them with the different needs in the future? And so if you are seeing that in 2030, there's an expected shortfall of workforce in the healthcare sector of 10 million.
Nurses, doctors, orderlies,
Nurses, doctors,
everything.
surgeons, orthopedics, dental, everyone. 10 million shortage. And at the same time, we see that the pressure on the health system increases. We have aging, we have non-communicable diseases, we have pandemics, we have floods. And then there's this need to actually reduce the cost of healthcare and move care closer to the people. So this requires a complete different workforce. Technology is going to disrupt all of that. And so what we're seeing is that
do more with fewer people
yes,
as much as possible.
Well, because we are going to have to do more.
Force multipliers.
And we are going to do it with less people. So we already see this in, for example, in the intensive care units. Normally you have one intensive care nurse for 2 patients. But in many countries, in many regions, the ICU beds, there are no staff. There's no trained staff to do this, whether that's in the United States, in rural areas, or whether that's in Africa or in Japan. Now, what we're seeing with technology is that some of these observations, like AI, can actually help nurses on a distance. So you can start to increase the productivity of the nurse by saying, well, you can actually, with technology, take care of 10 intensive care patients instead of
monitor
2.
their data.
Let the data do the work.
Yeah.
And so the healthcare sector is the sector that generates most data in the world, right? And we've learned this week that the amount of data doubles every 7 days. Humans cannot deal with that overload of data. So we need to use technology to turn that data into knowledge and decision support. And that we see that's happening. And in fact, we saw that after the COVID, for example, radiologists, and that's a field that we as Philips are very passionate about, radiologists decided to massively work from home because they could. So they made the connection to the hospital, to the server, downloaded the readings, read them from the couch in the safety of their own homes and put them back. After the pandemic, 85% of the radiologists continued to work from home. And so this accelerated the move towards cloud solutions for radiology. Now, if you're moving images to the cloud, which is one of the biggest data guzzlers in health, then suddenly it doesn't matter anymore where the patient sits compared to the radiologist, could be on the other side of the world. And then you start worker productivity start to increase. And I think some of those solutions we are starting to see thanks to AI. I'll give you one other example. Nurses in the general ward or in the intensive care unit, they get distracted a lot by alarms going off. I don't know if if you've been to the wards, you always hear bleep, bleep, ping, different sounds going off, and everybody then kind of shocks, and the nurse is supposed to stop and then intervene and do something. 90% of these alarms are not really useful. They are not really relevant for the nurse. They scare the patient, they interrupt the nurse in whatever he or she was doing. And so we've been able to take most of that away and let the AI deal with it. And so if it's administrative or if there are other interventions that don't require human intervention, then let us take care of that so that we can organize the high tech
More
for high
data
touch.
about what the alarm was about. And
Yes.
then the needed action can be much quicker and
Much quicker by somebody else. So let the nurse take care of the patient
Yeah.
and not get the technology and the noise get in the way. And I think that's where we see the biggest changes and the biggest opportunity for productivity increases.
and this helps systems cope with more people, with hopefully keeping them healthy and watching out for just the right risks at the right time.
Yes. Well,
Yes, go ahead.
think of this at population level. At the moment, we are in a sick care system, right? So we are only taking care of the patients that actually show up in the healthcare system and say, I've got something, treat me. The move towards health means that we are actually starting to manage the entire population. So if we're going to help patients use technology to empower themselves to take care of their own health, if we're supporting that, if we're coaching that, then a lot of our healthcare system is going to move to health and well-being, and it's going to have a complete different emphasis into our healthcare. We all know that prevention is better than cure. They say, 1 gram of prevention is worth a kilogram of cure. We all know it, but it's not happening because the preventative action that you tend to take pays back in like 10, 20 years' time. Now, with longitudinal data, where you collect the data, where you can follow the patients throughout their life cycle, then you can start to really
Prevent more
prevent
earlier.
more, and you can see the return for the economy, for productivity, for society, for the environment. And so it will require a different kind of workforce, a different kind of skills, communication skills. You're not sick, you're okay, but we're going to keep you okay. Let's go and work on behavior. Let's work on monitoring. Let's process more data. And we have to do that with fewer people, caregivers, because we want healthcare to have better health outcomes at a lower cost to society and a lower carbon footprint. I call it the win-win-win. And that's I think where technology plays a huge role. And then also a huge role to keep the workforce motivated and empowered, because the workforce needs to get up in the morning and go to work and say, I feel empowered. I feel I have the tools. One of the biggest things that we saw in many of the emerging markets, that nurses and radiologists and biomeds were walking away, is because when they walk into the hospital, they were afraid that equipment was going to be down again. It wasn't functioning. Something was broken. Something wasn't being supplied. And that's the most demotivating thing that can happen to the workforce, not being able to execute what they've been trained on.
You're part of this incredibly powerful coalition, the Partnership for Health System Sustainability and Resilience. Tell us what it brings to Abu Dhabi Global Healthcare Week.
We launched today the PHSSR report of the Abu Dhabi. And this is the work that has been done during the last 18 months. And this is one of the 30 countries where the PHSSR report has been done. And the launch was the part of the big Global Healthcare Week here in Abu Dhabi. And it's really a pleasure to be here.
Tell us about the report. What did it take to pull it together?
So PHSSR report is really looking at the number of the different domains that are important based on the London School of Economics research to identify what are the strengths and weaknesses of the healthcare local system. And we looked at in the Abu Dhabi report, as well as in all other reports, we basically looked at the domains like the workforce, service delivery, medicine, technology, governance, and finance. And the Abu Dhabi report is, in my view, interesting from two main dimensions, if you want. First is that Abu Dhabi is really impressive Middle East, Africa, but also global example of how healthcare ecosystem is moving super fast. Embracing technology, looking at the options how to make the healthcare system more sustainable and resilient came quite strong from the report. Equally, the dimension of how governance plays here for the strength of the healthcare system came also very strong. And it was very clear that the strong central governance of the healthcare system is very helpful, especially if you want to lead the transformation of the healthcare. And what we are basically looking at is what are the domains that can play differently in the future that will almost move sick care that we have today to the healthcare.
So what makes you hopeful, makes you optimistic when you do this work with the PHSSR? What gives you hope?
Yeah. So I think there are two things. One is that, we started PHSSR in the midst of COVID. And at that point of time, it was clear that healthcare systems were broken, no matter where you are in the world. And it was clear that, that will trigger the attention and really, really show us how important it is to take care of the healthcare system before they actually break. Because we went through the COVID, there may be another pandemic. Everybody are talking about the climate being the next biggest health crisis. I'm sure there can be more. So how we make sure that by managing the healthcare sustainability, we actually also prepare healthcare systems to be able to manage the crisis in a better way. And COVID was a wake-up call for all stakeholders in the ecosystem. The second thing that makes me feel comfortable is that the PHSSR is a non-profit global private-public partnership. PHSSR is a platform that brings all stakeholders together. And that means from academia, researchers, experts, governments, payers, technology or digital experts, pharma, etc. So bringing all these different partners together is something that hopefully should be enough to move the needle. And today at the launch of the Abu Dhabi report, that came out so clearly. It's not only about the report and understanding what are the strengths and weaknesses. It was really about the government and the regulators who are committed to action on the findings of the report. And that's what makes this project different from many others.
Leadership, political will.
Yeah.
Thanks for listening to this episode of the HealthBeats podcast. For more healthcare industry news, visit the Abu Dhabi Global Healthcare Week newsletter. The link is in our bio. You can like, subscribe, and follow HealthBeats by Abu Dhabi Global Healthcare Week for your global healthcare industry digest.